All right. So today we're going to learn all about the cardiovascular system, focusing on the heart. And the heart is a really, really, really important organ. It's very interesting. It's got lots of really cool stuff going on. Chances are you probably know somebody who has a heart issue, or has suffered some sort of heart condition. It's pretty serious stuff. So we're going to go ahead and learn all about it. We're going to learn the anatomy, the physiology. It's going to take us a little while, but it'll be totally worth it. So we're going to break this down into parts. This is the part one of our anatomy lesson. Today we're going to look at just an overview of the heart anatomy. So we're just going to look at kind of like where your heart is, what it's made of, and that kind of stuff. All right, so starting off with the organization of your heart is located in your thoracic cavity. It's actually located right in the center of your chest. If you ever watch like movies, people like get shot up here and they're like, oh, my heart. No, definitely does not happen like that. Your heart is about the size of a closed fist. So if you make a fist, that's about the size of your heart. The reason why this works is because the bigger you are, the bigger your heart is. The smaller you are, the smaller your heart is. So if you're like really petite, you probably have a smaller heart about the size of your fist. And if you're absolutely huge, you have a giant heart the size of your giant fist. But anyway, so if you make a fist, that's about the size of your heart, more or less, give or take. And if you put that right up here in like the center of your thoracic cavity, right on top of your sternum, that's about where your heart is located. And so it's in the thoracic cavity, it's medial to your lungs. It says about 2/3 of its mass is to the left of the midline. The reason for this is that your heart is actually turned a little bit. So if you were to actually, it's better if you do this with your left hand. So if you take your left hand and put that on your heart and then turn it so that like the bottom of your, so you kind of turn your hand so your fingers are face down, that's about where your heart's located. And then if you go down the middle of your chest, you'll see that about 2/3 of it are now on the left side of your body. By the way, interesting little fact, when you get married, people put their wedding band on their left ring finger. Reason for that is because your heart is slightly more on the left side of your chest. It's not that it slides over to the left, it's that it's rotated over to the left a little bit. So if you look at this illustration up here, you can see that the little tip of the heart, which we call the apex, is pointed very much towards the left. And in fact, interesting little fact, your left lung is actually a little bit smaller than your right lung because of this. Your left lung only has two lobes. This is the superior and this is the inferior lobe. And your right lung actually has three lobes. It is a superior, middle, and inferior because more of the heart pushes over towards the left. And if you're interested in embryology, when you were a little embryo and your heart was growing, it actually grew straight down the middle and actually started to turn to the left as it developed. So it actually kind of does that a little bit later into its development. So anyway, when we look at the heart, it's got a couple little parts, one of which is called the apex and the other is called the base. So the tip we call the apex because it's like the point of the heart. And so the heart kind of starts from the blood vessels and then extends out to this apex. So that's like the tip of your heart. This part up here we call the base. And I know that's kind of backwards because usually like the base is on the bottom, but the heart is kind of like an upside down organ. So it's got its base up here by the blood vessels, apex down here at the tip where it kind of ends. And so here's a better picture of the whole thing all together. So you can see here's the heart. It sits right on top of your diaphragm. Your diaphragm sits right underneath, completely surrounded by the lungs. And then it has all these great vessels up above it that conduct blood to and from it. And then if you look in the side view, you can see this is our sagittal view of the heart. The heart has kind of an interesting shape to it. And it actually is connected to this blood vessel called the aorta, which flips upside down and then goes down through the diaphragm. All right, so let's talk about the layers of the heart. The first thing we're going to talk about is this thing called the pericardium, which is like the little sac that surrounds your heart. And the pericardium, literally meaning like peri, like around, and cardium, heart, it's the around the heart, is broken down into a few different layers, like everything in anatomy. So the outermost layer is what we call the fibrous pericardium. And you can guess this is made of dense, irregular, fibrous connective tissue. So it's got a lot of collagen fibers. And we know collagen always makes things strong. That's right. So this area is a little bit, it's kind of like the protective shell of the outside of your heart. And so what you see all the way out here, here's the fibrous pericardium. So it's the outermost layer. And it's going to protect the heart. It also keeps it from stretching too much. You don't want your heart to get too big because it can actually rupture. And that's not good. Nobody wants to, die of a broken heart. So we don't let that happen. It also kind of holds the heart in place. So you know how like people have like those little like things that say like this spot reserved for so and so. Well, that's basically what the fibrous pericardium does. It reserves all this space for your heart so that nothing else can go in here. So when your lungs expand and contract, your lungs can't like expand into the heart space and stop the heart from expanding because of this fibrous pericardium. Underneath of that, we have a layer called the serous pericardium, which is made of, guess what? Serous membranes. The serous pericardium is a lot thinner and more delicate. Basically, its job is to like lubricate the heart. So there's actually two parts, just like all serous membranes. There's a parietal layer, which is on the backside or the inside of the fibrous pericardium. And then there's a visceral layer, which is, of course, on the organ because visceral always means organ. So the visceral layer and the parietal layer are separated by this little thing called the pericardial cavity, which is filled with this fluid called pericardial fluid. And this pericardial fluid acts as like a lubricant, kind of like oil to keep the heart beating without having any sort of friction. So you know how like when you rub your hands together, they're kind of like, it makes noise and you can feel it. And if you rub them really fast, eventually it gets hot and you might get those little like weird, bits of skin on your hands. Anyway, imagine your heart beating 60, 70, 80 times per minute. If it was rubbing up against something and causing friction, it would become very hard, irritated and hot after a while. So in order to prevent that, we have this pericardial space with this pericardial fluid that helps us to kind of lubricate everything and keep it really nice. So that's the reason why this is really important. So this pericardial fluid fills that cavity. It's kind of like a synovial joint, if you remember how we had like synovial membranes with fluid in between, except this is serous membranes with serous fluid. And here's a close-up if you want to see this again. So you can see it's not a huge space, but just enough to give us a little bit of space for the heart to move in. And also things to know about this layer, this visceral pericardium, is very smooth and slimy. It's actually made of simple squamous epithelial tissue, and so is this parietal layer. So we just have a very thin, very smooth layer and a little bit of fluid in between to kind of lubricate it. All right, so that brings us to the heart wall. The heart wall is what actually makes up like the bulk of the heart muscle itself, and it's made of three different layers. The innermost layer is called totally blew that one. The outermost layer is called the epicardium, and we always know epi means outer or on top of. So just like your epidermis was like your skin, it was on top of you, the epicardium is on the outside of the heart. It's the heart skin. Interesting little fact, the epicardium is the exact same thing as the visceral pericardium. So we have two names for the exact same part. So we can go back here and call this now epicardium because you can see it's on the outside of the heart. So it's both the innermost part of the pericardium and the outermost part of the heart. Confusing. Anyway, underneath that, we have this really thick layer of muscle, and this is called the myocardium. So if you remember from our muscle chapter, myo means muscle. So this is the middle muscular myocardium. Don't you just love alliteration? Anyway, so it makes up most of the heart, and it's what does all the pumping. So a lot of people like to say the heart is a muscle. It's an organ that's made of a lot of muscle tissue. I don't know. I guess you could call it a muscle too. I mean, muscles are all technically organs too, but this is really the muscle part. So that's where we find our cardiac muscle. And then the inside, we find this thing called the endocardium. So of course, endo means like inside. And this is made of simple squamous epithelium that lines the inside of the heart and prevents blood clots from forming. So if you guys remember, we talked about endothelium back in the tissues chapter. And so endothelium is what the endocardium is made of. And so it's kind of like continuous with the blood vessels. If you remember, we had that tunica intima, which is made of simple squamous and allowed the blood just to slide past and not stick. That's exactly what's happening here. So the endocardium is kind of like the Teflon, like the non-stick coating of the inside of the heart wall. All right, so real fast, we've already talked about this at least twice this year, but we're going to talk about cardiac muscle tissue really fast. Basically, cardiac muscle tissue, they're muscle cells, but they have a couple weird things about them. One thing is that those intercalated discs, which are like those little finger-like extensions that allow them to interlock and hold them together. They also have these little things called gap junctions that allow action potentials to go in between the fibers. And the reason why they do this is because the muscle fibers have to send action potentials from cell to cell to cell all the way through the heart so that the heart can act as one big unit. So basically, there's millions maybe, I don't know, tens of millions, hundreds of millions of cells inside of your heart. Each of those cells has to connect to the next cell so they can send the signal all the way across. It's kind of like doing the wave. If you ever done the wave before, how like the first person's like, whoa, and the next person's like, whoa, and then they go all the way around. That's exactly how the heart works. So those gap junctions allow this to happen. A couple interesting properties about cardiac muscle tissue. Number one, all the cardiac muscle tissue in your heart is broken down into two networks, one for the atria, which is in the top of the heart, another one for the ventricles, which are the bottom of the heart. Each one of those networks works separately. So when your heart beats, you know how your heart's like thump, 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 thump. So when we look at the heart, it kind of goes top, bottom, thump, 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 thump. And so that top part is the atrial network contracting. The bottom part is the ventricular network contracting. And so that's why you hear that two part of your heartbeat. And the third thing to know about this is that cardiac muscle has very long contractions compared to skeletal muscles, so that it's 10 to 15 times longer. Basically, it allows that thing to really squeeze down and push all the blood. So we have this kind of elongated contraction. That's why when you listen to like the heartbeat, it's like thunk 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 thunk, and then when it gets faster, it's like the thunk the thunk the thunk the thunk the thunk. But there's always like a pause. It's not like thunk. It can't stay contracted. Each contraction's longer, but there's like a gap in between each contraction. And so there we go. This is another view of what our cardiac muscle tissue looks like. And down here, you can see this is where two cardiac muscle tissues come together. You can see they have all their wonderful little sarcomeres. And there's these things called desmosomes, which we talked about in the skin chapter. Those little hooks that hook them together so they can't separate. And that's what's going on inside of those intercalated discs to help hold them together. We also see these gap junctions that allow ions to flow from one cell to the other. So when one of these cells goes into its action potential and starts having a whole bunch of sodium ions go inside of it, we can see that some of the sodium ions can flow down into this next cell and cause it to hit its action potential. So all these cells, even though they're individual cells, they kind of work together as like one giant cell network, which is cool. All right, so that brings us to the chambers of the heart. And I mentioned this before. There's two types of chambers, atria and ventricles. The atria are on top of the heart. They're the superior chambers, and they're the receiving chambers that pick up the signal, pick up the blood that comes into the heart from the veins. The atria, we call them RA and LA because there's a right atrium and a left atrium. We're just going to call them RA and LA to keep things really simple. They're separated by this thing called an interatrial septum. And septum you may have heard of before. Like, for example, this little thing in between your nostrils is your nasal septum. There's also a septum between the atria that keeps them separated so that the blood doesn't mix. So the blood can either stay on left or the right, but they can't come together. In between them is this little thing called the fossa ovalis. And literally, fossa ovalis means like the oval depression. And the reason why this exists is that when you were a fetus, you guys remember this, being a fetus, there's a hole that exists in all fetuses' hearts and basically allows blood to go through from one atrium to the other and bypass your lungs. Because if you think about it, a fetus being inside the mother's womb doesn't need to use its lungs. So we have this little shortcut called the foramen ovale, and that's what's listed right here. The foramen ovale is this little shortcut in the fetal heart. And as soon as a fetus is born, and the baby takes its very first breath, there's a little tiny flap. So imagine there's like this hole. This little flap comes down and covers up the hole. But where that hole used to be, there's like a little tiny divot, like a depression, that remains as the fossa ovalis. Now, what's interesting about this is that in some babies, when that little flap comes down to cover the hole, it misses by a little bit and it leaves the hole open, or misses completely, or just like never comes down. And so there are some kids that are born with a hole in their heart just because that flap didn't do its job. So that's like one way that people are born with a hole in their heart, if you've ever heard of that before. Third thing to talk about in the atria are these things called auricles. And I'm going to show you a picture of these. So here's our atria. So here is our right atrium. Notice it's on the left side because remember, anatomically, everything's backwards because it's the patient's. So this would be our right atrium. Here's our left atrium. And you can see they're like smaller than the ventricles down here. And you can see right in here, this is our fossa ovalis, this little oval depression that used to be a hole that allowed blood to go between one side to the other. Oops, wow, just kidding. That didn't work at all. Let me go back for a second. If you look at the heart, you can see that there's actually like a little tiny flap that hangs down. This is called the auricle, and there's a one on this side too. The word auricle, if you remember from a long time ago, auricle is like also the name of the outer part of your ear, and so literally auricle means ear. So I guess when people first started looking at hearts, they thought that this looked kind of like a floppy, like dog's ear or like a floppy rabbit's ear or something like that that was kind of hanging down. And what's interesting about this, the auricle is actually a little fold of tissue. And when your heart is empty, it looks like this. But when your heart fills up with blood, this thing opens up, fills with blood, and then squeezes out kind of like bellows. So it's like open, close, open, close, open, close, thump, dump, the dump, thump, dump. And so that's what these are. They're like little extra pockets for blood. Blood pockets, great. Anyway, so that's what the auricle is. Also, the name of our school newspaper. Just kidding. So anyway, the atria, their job is to receive blood from the veins and hold on to that blood and then pump it into the ventricles. The ventricles are the bottom chambers that do all the pumping. So they're the inferior chambers. We call them the right ventricle and left ventricle, or RV and LV for short. Much, much, much stronger. The walls of the ventricles are incredibly thicker compared to the atria, and they have an interventricular septum that separates them. So if we look in this illustration, we can see here's the wall of the atrium versus the ventricle. Ventricle is much thicker, obviously. And in fact, if you look, the right ventricle has a much thinner wall than the left ventricle. Reason for this is that the right side of your heart, if you notice it's got all these blue vessels, it receives blood from your veins and pumps that blood to your lungs, which isn't that far away. The left side, though, receives blood back from the lungs and sends it off to the entire rest of the body through the aorta. So because it has to pump to your whole body, it needs a much, much, much thicker wall. But the ventricles, they do most of the pumping. They're what carry most of the load of your heart. Guess what? That's it. We've gotten to the end of part one, and you've survived. Now you know the basics of the heart.